Okay, so let's answer the whole question. I get this question heaps of times. Whenever I'm doing my paediatric emergency course or any of my acute deterioration stuff or anything around sepsis and fever, I get the big question about should we be giving children paracetamol or ibuprofen when they've got a high temperature to prevent them from fitting, from having a febrile convulsion. And I'll let you make up your own mind as to what the answer is. There's not an easy yes or a no. Well, there is, but let's just talk about it first. Stay with me on this topic. It's going to be a little bit of a longer video, this one. Okay, so first of all, let's understand the concept of febrile convulsion. At one point in time, we believed that if your body temperature rises, there was a certain age group, and we know that to be about 6 months, probably a bit younger, but about 6 months to 6 years of age, although more than 90% of febrile convulsions happen between 6 months and 3 years of age. So 6 to 36 months, okay? So that's kind of your danger period for febrile convulsions, if we should continue to call them that, febrile convulsions to occur. Febrile convulsions almost certainly are seen in people who are susceptible. So if that particular child that you're caring for has had siblings or parents that had had febrile convulsions, there tends to be a higher incidence in them. So they can be a little bit more susceptible. There are probably some familial genetic factors. Yeah. But let's understand that febrile convulsion is an old-fashioned term. We don't have a new replacement term for it, but it's an old-fashioned term that stems from a time in our history where we genuinely believed that as body temperature went up in this particular population, this age group, that the higher the temperature, the more likely that child would be to fit. And we know that's just not the case. So a child with a temperature of 39 is no more likely to fit than a child with a temperature of 38.5. A child with a temperature of 40 is no more likely to fit than a child with a temperature of 39. It's not about how high the kid's temperature is. So it's not really a convulsion that's induced by the fever height. It's about how fast the fever takes place. So if a body temperature rises very rapidly from, say, normal, 37, up to 39, if it was a rapid increase in temperature, that can trigger a febrile convulsion. Likewise, if they're already hot, let's say they had a temperature of 38.9, or round it up. Let's go, the child's got a temperature of 39, they've been cooking along with a temperature of 39 for a couple of hours, and then suddenly they develop a rigor and they have another spike up on top of that. And the temperature goes from 39 up to 40 or 41. The rapid rise, that's the thing that triggers the febrile convulsion. So it's triggered by a rapid increase in temperature, not by the number on the thermometer itself. So that's the first point. The second point is, how do I know it's a febrile convulsion and not something sinister? And if you've ever seen a febrile convulsion, my God, they look sinister. They're awful to look at as a nurse. They're frightening to experience if you're a parent, and I've been in both camps there. So let's just understand right from the get-go what a febrile convulsion is. It's benign. It doesn't cause them harm. A febrile convulsion, if it is a true febrile convulsion, is not going to cause brain damage, whether I do something to stop them from fitting or whether I don't, and I just let the fit play its course, it's not harmful. So that's kind of number one, and that's something that we can really pass on to the parents who are probably freaking out if they've never seen this before. Okay, so there are three criteria for a febrile convulsion. The first criteria is it only happens in the first 24 hours from the time that kid first got sick. So let's say that child developed their first fever at 10 a.m. If they have not had a febrile convulsion by 10 a.m. tomorrow, then any fit that they have after that is not a febrile convulsion. It's something more neurologically sinister and should be investigated. So it's inside the first 24 hours. The second criteria for a febrile convulsion is they will only have one. They'll only have it once. So if this child gets a sore throat or a chest infection or an earache or anything that would normally cause a rapid rise in temperature and then go on to have a fit, they will only have one seizure, one convulsion in this period of illness. So they have to have it in the first 24 hours and they'll only have it once. So if that child's been brought into you and there's a good story of them having had a fit at home and they're rushing in, the parents have rushed them in or they've come in by ambulance, they're in the clear now, they're safe. That child, irrespective of how hot they are, that child's not going to have another fit. They're just not. And if they do, it wasn't related to the temperature, it was something more neurologically sinister. Think perhaps some sort of an invasion of the brain or the meninges, a meningitis or an encephalitis. But it's not a simple febrile convulsion if they have more than one fit for this illness. Now, in a few months' time, that kid could get another earache or another chest infection and have a febrile convulsion. But for this illness, they'll only have the one fit and it will happen inside that first 24 hours. The third criteria, and this is an important one, they last less than 5 minutes. That's it. They don't go on and on and on. In fact, the vast majority of febrile convulsions will last for less than 90 seconds. By the time you've drawn up your midazolam to squirt up that kid's nose or your diazepam to put PR, by the time you've put the rails up and consoled the parents, often the fit has finished. It is absolutely reasonable to keep them safe while they're fitting. But the fit is self-limiting. It stops after around about 90 seconds and never goes longer than 5 minutes. And all the time that they're having a seizure, of course they're getting hotter, but it's not making the seizure worse. Their cooling and their comfort measures can come after the seizure has finished. Keep them safe, pad the bedding area, make sure they can't hurt themselves by banging on the bed rails or on the cot. And provide a lot of psychosocial support to the parents because it's damn frightening. Febrile convulsions. If we have to treat them, midazolam is the therapeutic of choice, and it's usually given intranasally through a small mucosal atomisation device, a MAD. If you want to see one of those, I can show you a picture of one of those, or I can actually demonstrate one. I've got some in my cupboard, and I can pull some out later. Febrile convulsion. Not related to the temperature height, but certainly related to the speed of the rise. Last point, and this is an important one. We have known since 1972, like a long time, that paracetamol and ibuprofen and any other antipyretic drug does not prevent febrile convulsion. I'll say that again, just so that you can make sure that you heard it. Antipyretic medicines do not prevent a febrile convulsion. If that child's going to have a febrile convulsion, they're going to have one irrespective of whether you have given them an antipyretic or not. So don't think that you're doing anything kind by giving an antipyretic to somebody on the premise that it's going to reduce their risk of having a fit. A child will fit if the child will fit. It's just the way that it is. And often it's when that paracetamol has worn off and the temperature now has a window where there's no drug on board for that temperature to spike. 2 o'clock in the morning after parents put them to bed at 8 p.m. So you can make up a decision as to whether you want to administer paracetamol or ibuprofen to a febrile child, but don't think that it's going to reduce their chance of fitting. It just isn't. Happy to take your questions.